I'm Dr. Fungi Majandu. I'm a psychiatrist based primarily at Annex Perinatal Hospital. I'm also the current chairperson of Zimbabwe College of Psychiatry, and I'm also the chairperson of the special board at Chikurubi, and I run my private practice. Yes.
Well, Dr. as we have discussed before regarding your profession and the issues that on the rise right now, gender-based violence. You are aware we are commemorating 16 days of activism against gender-based violence. What are the issues to do with mental health that relate to GBV?
Okay, so there's a sort of a relationship, a dual relationship between gender-based violence and mental health. What I mean by that is some mental health conditions increase the prevalence of gender-based violence, right? Increase the prevalence in terms of the perpetrator. But equally, one of the products of gender-based violence is mental illness, where you find that people who've been exposed to that as a survivor of gender-based violence, there's more depression, there's more anxiety, and other conditions, even increased substance use disorders because of having been involved in gender-based violence. Yeah.
Well, how do you identify that one has got some mental disorder, mental illness, and at what rate, at what level would you say this is a mental issue at this level, at an out stage? Or
Okay, well, commonly, like for us, we use a diagnostic criteria, DSM, to see using what we identify clinically, so like signs and symptoms, to say that now this person has a mental illness, right? But then even when you diagnose the mental illness, you do know that certain mental illnesses, they have complications, like what happens because of that. And some of the complications can be violence. We know that one of the complications of alcohol and or substance use disorders is an increase in violence, violence between partnerships, so that's gender-based violence or violence in the general population. We know that some of the sort of outcomes of somebody who's depressed or doesn't know how to communicate or has mood disorders is that they can also be violent. So these are the issues that you'd want to tackle to avoid or reduce the prevalence of gender-based violence.
well, you have had, and the government is also appealing to the public on the issue of use of drugs, illicit drugs. Does it also include the issue to do with mental illness?
Absolutely, using drugs and having a drug problem falls under mental illness. And we have seen that because of that abuse of drugs, you do get an increase, like I said, in gender-based violence. But equally, we also know that some people who've been, exposed to gender-based violence, who've been abused, may seek to use drugs as a form of solace or forgetting. I think I've seen a lot of interviews with a lot of young adults, and they say things like, I want to forget, that's also a sign of somebody who may not have dealt with healed trauma.
Well, in your practice for a period of time, can you give a rate of how many male adults, females who have been, you think?
From my time at Chikurubi, there are a lot of cases where you could say that the findings. So in Chikurubi, there's a special psychiatric unit. So I was definitely already seeing patients who had exhibited some form of violence, or had committed a crime. Not necessarily violence, maybe they've stolen something, a theft, something like that. But you'd find that in the cases where there was violence, right, which can happen with a lot of men, issues were to do with things like substance use disorder, and a lot of the violence that would occur was with intimate partners.
Oh, okay. Then maybe you could also assist. What can be done? You may recall there's always an issue to approach the police to settle some personal scores, some issues that may arise within a family center. What advice can you give to people who may be facing some problems which may be related to mental illness and is to do with GBV?
Okay, I think before you even get to that stage where you're not talking to the police, it's useful that people are aware of how they are feeling of the mental status and they seek appropriate care. It's better if you walk by yourself to Paringa to a hospital and you say, can I see a psychologist? Can I see a psychiatrist? That's the best case scenario. Obviously, there are situations now where the person doesn't have what we call insight. They aren't aware that they themselves have a problem. It's also useful in those situations that your family, your friends, your relatives, colleagues can step up and do that for you as a person to say, let's go to Annex, maybe you can, talk to someone about your issues. But then equally, like you said, at some point the violence has occurred or is threatening to occur, and you're now at a stage where you're at police level. I think it's very good that the police are trying to mediate in these situations. Possibly a way to better that system is for the police also to interact with, psychologists and psychiatrists and other therapists, and have a better sort of ability to deal or mediate in those situations. It's not just everybody who can talk to people and sort out the issues, and even if they can, these are police officers who have a scope of duties. It's not every time that they have 30 minutes. A session with a therapist is 32 minutes to 1 hour. So the police may not have 30 minutes. They may not have 1 hour to sit down with you. And your issues may be issues that require that you continue sessions. So I think it's important that the police be equipped with these tools, even to screen, right? To just like a screening tool which will give you a score, and have resources so they know, okay, this is a bit beyond our time or ability, and refer the person appropriately.
Okay, maybe in conclusion, you would want to say in regards to awareness. People, the citizens, are they aware of where exactly to get assistance? Or are they knowledgeable to these facilities?
Okay, there are lots of facilities. There are places that you can go to within Harare, such as the Annex, right? There are psychologists there, there are psychiatrists there. You can go to Salim Kabir Hospital as well. There are psychologists and psychiatrists there. You can go to any provincial or district hospital within the country and they'll direct you otherwise. There are private therapists which you can look up. There's a therapist directory online. It will give you access to information about psychiatrists, psychologists, social workers. So that's important as well if you want to take the private route.
Yeah, but I was asking, are people aware in terms of response?
There's an increase in awareness, an increase in uptake of our services. But to say that when we look at what we call, there's a thing called the mental health gap. I don't think we've reached anywhere near close to meeting the needs of those who have a mental health disorder. So it's useful, and I'm grateful for opportunities like this where we keep raising that awareness. I think it does take those who know in the community to keep discussing these issues.